Call it a mission of mercy, the mission of not-for-profit healthcare facilities all across the country. Most of us probably don't think about it during a hospital stay or a visit to the doctor, but for more than 1 million uninsured Tennesseans and tens of millions of uninsured Americans, that mission is critical.
It's a society issue, but it being a not-for-profit hospital, you're primarily, that's your mission, is to take care of those type of patients. That's part of the community benefit that you give back for being classified or qualified as a not-for-profit hospital.
That message of giving back can easily get lost among concerns over spiraling healthcare costs. But giving back is just what not-for-profit healthcare is all about. In fact, 98% of the money that comes into not-for-profit hospitals goes right back into the community in many ways. For instance, education. Not only by training a new generation of healthcare workers to fill a growing need,
the tablets are 125 milligrams apiece,
but also by raising public awareness through health education, public service announcements, free community health fairs, and more.
Have you gone and had any tests or anything done since I saw you last?
A major part of giving back is taking care of the physical needs of patients. So a sizable portion of the not-for-profit hospital's funds goes toward keeping up with advanced technology and adding new services. Factor in the possible dismantling of TennCare, and the role of not-for-profits takes on an even greater meaning.
What we understand from the reform plan that the governor is proposing, about 430,000 individuals will be without TennCare. But that doesn't mean that they still don't have health care needs.
Providing charity care to meet those needs is no easy task.
We're presently trying to serve people that are indigent, but a bigger piece of our population is homelessness. And health care for those people, I mean, you're talking no access, no transportation.
That was the challenge. How to bring the homeless to a health care facility. The answer? Bring hope to the homeless. The Hope Healthcare Van, a joint venture between Baptist Memorial Healthcare and Christ Community Health Services, is a mobile medical unit that makes specific stops at agencies that serve the homeless. And in only a few months, it has made a major difference in the lives of many.
I was worried about what I was going to do about my medical care because I'm on heart medicine and different things. They have helped me with my medications. They will pay for your medications if you cannot afford them. And they also have medications on hand that they will give you. And it really has helped me a lot. If it wasn't for them, I don't think I'd be here right now.
Hey dear, how you doing?
I'm doing fine. How you doing this morning?
All right.
Here, patients get help in a number of ways. Not only with free screenings and medications,
As long as we got medicine, you'll have medicine. Okay.
but also through referrals, counseling, and sometimes just a caring listener.
Help me help you. You know, what is it that we can do other than medical to help you get back on track?
It's like being nursed back to health from being in a coma, per se, especially when you don't know that you have ailments.
Thanks to the nurses on the Hope Healthcare van, Daryl discovered he has high blood pressure and an enlarged heart valve.
I had never felt any symptoms before. As far as I was concerned, I was in great health. And it's quite welcome to me that, I had the free service. And they was able to treat me, and now I got my blood pressure under control.
The team on the Hope Healthcare van has emphasized the message of not-for-profits, one patient at a time.
We have seen people, lives change. We've seen people go from coming in the clinic intoxicated to sobriety. We have seen people jobless, and because now their health care is better, they're working.
Makes a person feel good that you're in good hands, someone who's going to be there to help you out.
Just to know somebody cares and is concerned about me, I mean, that really helps me a lot, a whole lot.
And the mission of mercy rolls on. For Smart Medicine, I'm Rod Starnes.
The healthcare van is now called the Baptist Operation Outreach Healthcare Van for the Homeless. And these dedicated workers continue to reach out to the community. They're adding more stops to reach more patients than ever before. We spoke with Brenda Evans, who you just saw in the story. She says the effects this program is having on the lives of patients are immeasurable.
The thing that I like is when I hear stories of that person was homeless, and now because they have their health back, they're no longer homeless and they're productive. That's the key, because this is what this is all about.